Dr. Lisa here. I'm really considering putting out, I want to say a daily blog, but just getting consistent with just a live or recorded, could be pre-recorded blog about how we get through this era. This is an era. This is an era of mass adoption of AI and health tech. You know, I'm still sitting in the realms of health and the changing definitions of that. And being here in the U.S., I just think this is all we got. This is our digital footprints. This is like our hieroglyphics. I'm just thinking about ways you can post, you can influence what's out there for them to data grab. Like, I know we just went through like a whole bunch of like IP sort of stuff, and I was working with people with their brand and protecting their brand, but like, I think we're gonna need the soldiers out there that are like just getting on and being human. Because people can't tell the difference. And I'm coming from a human development. I'm sorry I'm sitting here trying to use the acoustics of my bathroom. It's a little bit plain background here, but if you can just focus on me for a few moments and really think about what is the best way to fight fire with fire. And I'm not even saying fight. I'm saying to introduce a variable that they did not anticipate coming, because it is plain to me, and thank God, literally, thank you, God, for making the most violent, emotionally closed off. I feel that there's an illness there. There's definitely some sort of social, civil, mental, emotional, physical illnesses at play when we get to this point in society, which we've seen where people just lose the plot, right? And like when I see healthcare bidding, I made a post yesterday over on LinkedIn. I'll leave it in the comments if you're interested. But like, they have nurses bidding against each other. Like, they have like 3 or 4, maybe even 5 platforms now that are like so excited. They're the Uber of nursing, and we all know what happens. Like, is that what you want? Like, when I see healthcare getting into the game of it's gambling, guys. Gambling is all over. We have an addiction problem. You know, like, I'm coming from human systems, and you know, if you don't know my history, I was always into human beings, and I opened up one of the first in the nation, like, completely cash-based boutique physical therapy practices inside an integrative yoga therapy, one of the first integrative yoga therapy centers in this freaking whole country. Okay? Did I do it to be like first or whatever? No, I did it because I couldn't get any of the clinics that I worked for at the time as a physical therapist and a certified athletic trainer to understand what I was saying about women, athletes, active women, stress, mind over body. You know, I was in New York City at the time, and I was literally getting the patients of Dr. John Sarno, who had written the book Mind Over Body, or Mind Over Pain, I think it was. He treated Rosie O'Donnell. He got really famous. Like, I had his patients early on, and I really had been a dancer, and I'd been working with dancers from Broadway at the Sports Therapy Center in Manhattan, and we even had internships. Thank you, Hunter College. Shout out to you for having really great internships with the tri-state area's best places. Like, I was at Kessler, at the facility that Christopher Reeve was at. Like, thank you. God bless. I got a big exposure. But before that, I went to Hofstra University again. And I was the lead student trainer in 1994 in New York State for athletic training, which was also cumulative. Mind over body. So like I had a huge background from being a young dancer and going into and understanding athletics and orthopedics and sports and how you made the athlete and how it was like literally taught and got a BS degree and like how you like had to like make sure their mind stayed in the game and what the implications of that being on the field for performance. And then I went in sort of the other extreme in healthcare and medicine, because healthcare is a lot of things. Which is what I'm working on now with these types of projects of just keeping the human in the system, okay? Especially through this kind of AI or whatever. And this is the way to do it. But I had this huge background and I saw the split. I saw the bifurcation between medicine and actual health. And I created a portfolio career because of being a woman in that knowledge base. Because I wanted to have my kids in my 20s. Because I wanted to be just over 50 right now and my kids be grown up. Because I wanted to parent a certain way. And this country, as much independence as I had and as much, autonomy as I had to get my degrees and influences, wasn't meeting that. And that's a very, very different perspective right now, I think, going into this AI era. And trying to say, I'm not looking to save healthcare. Listen, medicine is ruined in the US. It never was really in a right, its intent was never really where it should have been, right? But community health has a great big opportunity right now. And I think what's going to have to happen, because there's a huge loss of trust and this whole stuff with Fauci and the way they're trying to use it politically, it's just going to make it worse. And the pandemic and the way that hospital systems treated their own workers. And now that I'm looking at, and like I said, I posted over on LinkedIn if you want to take a look at it, how they're starting the bid wars with nursing and this gamification. And we have addiction problems. And this is just the tester. Because there's nothing, listen, if they put it into nursing, there is nothing stopping it from being in IV rehab or benchmark physical therapy or anything else. We've already seen it with Hinge Health and Sword Health come in and just start pelvic floor programs. Just start pelvic floor programs. Why? Because you can do pelvic floor programs from multiple angles. And the profession that is probably the expert in bringing it and integrating it all together, along with all these like at-home blood taking kits and hormone kits. And it's not, let me tell you something, it's not going to be the physician. They don't have the skill. The allopathic physicians don't have the skill. So who's it going to be? Allied Health. But you know what? We have a huge, like I said, we have a huge trust issue. And it's going to be the people that can come on, who have credentials, but come on as human beings that will restore relationship. And I'm a big proponent of that. And I think I've always been somebody who practiced what you preach. I've never been comfortable with